pregnancy is an important aspect in the life of couples. It is a fact that conceiving without fertilization is impossible. But now with the rate of increased technologies, conceiving is possible. It is done with the help of assisted reproductive technologies, ART, using a process called In Vitro Fertilization, IVF. The process starts with the combination of sperm cells and egg cells for fertilization in a lab dish. The obtained combination is transferred to the uterus. This is done for implantation. Many reasons are laid down for the impossibility of fertilization. But, IVF has changed the face of this condition. It has become a successful weapon to deal with the difference. It has become an attempt to form twins with nature's revelation. There are 1 million of babies born with the help of in vitro fertilization. The in vitro fertilization technique is conducted stepwise. Initially, hormonal injections are injected. This injection will help the growth of many follicles in the ovary. This procedure is called superovulation. The growth of the follicles is tracked by sonography. In this process, 5 to 12 mature follicles are grown with a size of 16 to 18 mm. The mature eggs developed can be collected after inducing an HCG, human chorionic gonadotropin, injection that helps in ovulation. This is done by ultrasound-guided aspiration. This in turn will pave way for sucking the follicular fluid that contains the egg through a needle into the test tube one by one. Retrieval of 416 eggs can be done in 10–40 minutes. Further, the embryologist will examine the obtained follicular fluid in the IVF lab. The examination is under stereozoom microscope for good quality eggs. The obtained eggs are washed in a medium for their maturity, later transferred into the carbon dioxide incubator. The process of insemination can be done after 2 to 6 hours. On the same day, the husband's sperms are separated from the seminal plasma by sperm washing. These washed sperms are further used to inseminate the eggs. With each egg in a separate dish, about 100,000 sperms per milliliter are placed. These separate dishes are placed in a carbon dioxide incubator at a temperature of 37 degrees centigrade. After a period of 18 hours of insemination, these fertilized eggs are identified. The finally obtained fertilized embryos are left in the culture medium. The embryos continue dividing and they have 2 to 8 cells, which are of equal size having a clear cytoplasm. This clear cytoplasm is obtained after 48 to 72 hours. Now the embryo is ready for transfer into the uterus. This is done on OPD, outpatient department, basis. Mild sedation is given to the patient. At a time, 1 to 3 embryos are suspended in a drop of culture medium that are drawn into the transfer catheter. The embryos are deposited into the uterine cavity through the cervix with the loaded catheter. 20 to 40 minutes are required for this. After the procedure, bed rest is advised for a few hours. Superovulation helps in obtaining many eggs required for fertilization from sperm, resulting in many embryos. Freezing is possible for these embryos at a -196 degrees centigrade. This can be used in further for many years.